Hi, so Sabrina again, and today I'm going to start the first series of videos regarding the myths about depression. And I know that last week I talked about why I was going to be doing this and the whole purpose, and I kind of want to reiterate that because I don't want any confusion about the purpose and the intent of these videos and what my hope is through them. Um, First of all, I am a nurse and I have done a lot of medical research regarding depression, but I am not an expert. I am not saying that I 100% know all this information and can say exactly and precisely what the treatment is or what the appropriate protocol should be. But what I can tell you is my experiences combined with what I have found through medical research regarding depression and the physical attributes that go along with it, the emotional and mental attributes that go along with it, and talk about those kinds of things. What I really want to do and achieve here is to give people a voice, to give people a sense of community, to know that you're not alone and you're not the only one, that you're not isolated. Don't be isolated. There was a great quote I read by an author for a book called Minute of Margin, and my godparents had given this to me a few years ago because I'm the constant, chronic, busy addict. I love to be busy. I love to be going. And one of the ways that I've always dealt with my depression is I have just stuffed my life with activity after activity after activity as a way to try to, first of all, distract myself from sadness and the issues that I didn't want to deal with. And the second thing was because I have a need to achieve. I like to basically place very high expectations on myself, make very high goals and a lot of goals, and I do my value accordingly. I allow those to determine what my self-worth is and my value. So I've always been very busy and have a very difficult time slowing down and allowing myself to rest. And this was a book that they gave to me, and again, it's called A Minute of Margin, and I can touch on that more next time or next week. But anyway, there was a quote that it was talking about, and the gist of it was this. When we're talking about depression in general, not even as a Christian, but just as in general, there are many people that feel ashamed of it. They have inappropriate guilt and inappropriate placement of guilt on themselves, which we will discuss next week as one of the symptoms of hidden depression. And they also, it's just a fear of rejection, a fear of being seen as inadequate or as a failure. And we're made to be ashamed of it. So one of the quotes was, he was talking about that we need to be a hospital, not a courtroom. And I love that because as a nurse, I know that the hospital I work in is committed to patient care. That's what we do. We care for people, we offer support, and we offer help. We offer treatment modalities that are going to be effective in healing them and helping them on the right road to recovery. That's my whole purpose as a nurse, is to provide patient care and help people so that they don't feel alone and that they do feel like they have the support system to become better and to heal from whatever elements they're going through and dealing with. And so I love that analogy to be a courtroom. Be a hospital, not a courtroom. Because what is a courtroom about? What happens in a courtroom? There's judgment passed down. And whether it's good or bad, you still have to enter this courtroom and you're under a microscope. You are being judged one way or the other. And you're being cross-examined, your life is being examined, your actions, your behaviors, everything. And I think that is a very good example of how people with depression feel. Like we are being examined all the time. And that if we acknowledge these things or we tell people that we're dealing with depression, that is what will happen. So we need to be a hospital, not a courtroom. Be a place that someone can go to for help, to get encouragement and support. Be a hospital to yourself. Allow yourself time and rest, and be gracious with yourself and others that are going through this. Don't be a courtroom. Don't cast judgment. Don't look to try to place blame and cast judgment on anybody else. So I want to start with that. And today I'm going to address just one of the myths. I've tried to do two of them, but it's very difficult to fit 2 minutes into one shorter duration video, and I don't want these to be too long. So Today, what I'm going to address really quickly is the myth that depression is not real. And on a second video, which I will do probably tomorrow, I'm going to address the myth that you can always tell when someone's depressed, because that is so far from the truth. So I just want to jump into this. I want to, first of all, start off with I think like a comparison and analogy so that it gives a little bit of perspective to why depression is actually a real illness. So when we think about problems, ailments, diseases, and illnesses and disorders of the body, first of all, what does that mean? Well, that means that the organ or the organ system is dysfunctional, or maybe it's gotten a virus or an infection, and so you're sick from it, or it's just not operating to optimal capacity. And so there are negative consequences within the body and the mind and the emotional health that come from those things. And that is what an illness or a disease or disorder is. And so when we think about that with depression, I know a lot of people don't understand the brain and how this can be an illness. It's like you just have to have a mind over matter and pick yourself up and, pull yourself up by the bootstraps and keep going. And that's all fine and dandy. And I do believe that there has to be some sort of a level of that within us in order to just get up and keep going. But that's not the overall problem that we deal with. So when we think about illnesses, we have to think about, first of all, the organ that's affected. So in this situation, it's the brain. And so when people say depression's all in your mind, well, yeah, I mean, it is. It's in your mind. And so when we think about that, we also have to look at what are the risk factors for illnesses and disorders and diseases. So let's think about in terms of, let's say, asthma. So when a child is born, the child probably is not born with asthma or any other type of respiratory disease. It does happen sometimes where they are born with dysfunctional lungs or whatever else is going on. They come into the world premature or having had complications from maternal problems. But the majority of the time, a child does not come into the world having respiratory dysfunction, such as asthma. So what are the risk factors for that? Well, premature birth, a mother that smoked or drank, family history, so you've got genetics involved. There's a multitude of issues that predispose a child to develop asthma. And so this child, let's say a child is born and they have a family history of asthma or other respiratory disorders. Let's say that mom smoked and set this child up for failure. Or maybe mom didn't smoke, but mom was in a household where there was a lot of smoke. And so this child has now been exposed or is more susceptible to developing asthma because of the risk factors that this child was exposed to or has. So now this child is born and the child is fine. Let's say everything is great, lung function is great, everything's going well. The only thing is this child has a higher disposition or is predisposed, to develop asthma. Now, that child gets taken home to a home that has smoking or mold. Let's say it's mold. There's other environmental factors that can contribute to this. So that child goes to that environment, and what's going to happen? It's inevitable that more than likely that child is going to develop asthma because, first of all, that child was predisposed to develop it, had a higher risk of development compared to other children because of the family history and the environmental exposure during its preterm delivery and just during its gestational time. So now the child is exposed to more environmental triggers and has developed asthma. Now the child has respiratory problems and has to be on medication, has to see a pulmonologist, has to change lifestyle and stay away from triggers, allergens that would cause reactions and can cause difficulties with breathing and potentially even death. So when we think about it like that, that's a real illness, and we have no problem acknowledging that that's a real illness. And cardiac disease, we look at people that are born into families who have a history of myocardial infarction, which is heart attack, before the age of 50, or hypertension or hyperlipidemia, which is high cholesterol and stuff in the blood. And these are contributing factors to developing heart disease. And someone that is born into a family with those has a higher likelihood of developing heart disease than someone that is born into a family without those factors. And so let's say a child is born into that family, and at the time, there is no cardiac disease, there's no atherosclerosis, there's no plaque in the arteries, there is no high blood pressure, anything like that. But over the course of the years, this individual is taught a sedentary lifestyle. They play video games instead of going outside and hanging out in the sunshine and playing with other friends. Let's say that they're taught to eat a bunch of fast food and that they don't eat healthy. So by the time this child is in their 20s to 30s, they have, number one, been predisposed to develop cardiac disease, and now their lifestyle has influenced that, and now they have developed heart disease. So what was not there is now there because of the risk factors that were involved, and now the lifestyle that has contributed to this development. Now that individual has to be on antihypertensive medications, probably cholesterol medications. They have to implement lifestyle changes, diet changes. They have to get out and start being active. And they may suffer with these issues for life, and they may not be reversible. So what was not there is now developed because of the risk factors involved and now lifestyle. So let's take that back, those two examples, and let's go back now to depression. So when someone is born, there is not, more than likely, any signs of depression, any diagnosis of depression, obviously in infants. We are seeing more depression diagnoses in children, and I really can't tell you why that is. I do know that what I'll get into here shortly is there are brain and chemical changes that are evident in depressive individuals as compared to those without depression. However, does depression cause it, or is it a cause of depression? That's what's still being studied. But the bottom line is this. The average age for the diagnosis of depression is 32. And females have a higher likelihood of being diagnosed with depression than males do. So those are facts. With depression, there are risk factors, just like there are with other diseases and disorders. So those risk factors are genetics. So there's a family history, any type of life stressors, long-term stress, trauma, grieving, loss, and that could be financial, relationship, death of a loved one, any other type of mental health issues such as drug addiction or other types of disorders, schizophrenia. There's a bunch of risk factors that are involved in depression or other mental health illnesses in general. So let's say those risk factors are present. This child is born into a family, does not have depression, and they're fine right now. There is no need for medication, there's no need for therapy, but they are predisposed to develop depression because they are coming from a family that has bipolar disorder and depression or Tourette's. They've got some schizophrenia, or let's just say none of those, as much as there is some mental health in the family, but there's also an abusive home, or there's a lot of trauma and long-term stress. This child is placed under a great deal of stress. So there are these risk factors that have set this child up to be predisposed to develop depression. Over the course of this child's lifetime, he continues to be, or she continues to be, exposed to stressors and trauma, loss of loved ones, any type of abuse, mental, emotional, verbal, physical, any of those things, or just stress in general. Maybe they come from a poor socioeconomic situation where mom and dad or mom alone are both having to work constantly, and the child is left alone a lot, or in daycare systems, or there's just a bunch of factors that go along with this. And sometimes there may not be any of that. Maybe it's just the fact that this child was born into a family that had, a depressive diagnosis, history of mental health disorders, and so this child is set up for that. Regardless of where the child comes from or what types of stress and situations the child goes through growing up, it's inevitable that we are going to deal with stress in this lifetime. Every generation has stress, and it's relative to that generation and that culture, that era of time, everything that's going on at those times. There's stress, whether it's good or bad, there's still stress. So long-term stress has been shown to be a very high risk factor for developing depression. So this child that was susceptible is now developed depression and is diagnosed at the age of 32 because finally they've cracked. And now that child that did not have it growing up has now developed it and has to have medication just like a cardiac patient would and just like a pulmonary patient would. The brain is an organ, and now it's malfunctioning. It's not performing at optimal capacity. And so there is a disorder there. There is an illness of the brain, just like there is an illness of the lungs and of the heart. So when we think about the myth that depression isn't real, that is very much wrong. Regardless of what anyone thinks about why depression develops or how depression develops or what exactly depression is, you cannot say that depression is not real, because it is. They have done studies that have shown several things, and I want to address those really quickly, and I'm going to try to wrap this up because my whole point here is not to give you a lecture, but to put it into perspective and help you see how depression as an illness of the brain is real. And if you want more research, you can definitely shoot me a message, put a comment down here, and I can definitely give you links to all kinds of research that's being done, that has been done, and that will likely continue to be done, just like with any other type of illness and disease. So in the depressive individual's brain, there have been several things that have been shown. Research has shown that there are a diminished amount of neurotransmitters such as serotonin and dopamine. Those are the calming chemical and the pleasure chemical. So when we talk about serotonin and dopamine, we're talking about the neurotransmitters that help us to feel good about ourselves, or in general, to experience pleasure related to things that we've accomplished, to be able to make decisions, to sleep well, to eat well, to function normally, and to, just in general, have a more elevated mood and a more controlled mood. When those are reduced, it's more difficult for an individual to be able to maintain a balanced mental health. And those are chemicals, and that's what we're talking about when we talk about a chemical imbalance in the brain. There is an evidenced lack of those neurotransmitters in a depressive individual's brain as compared to someone that does not have depression. The second component of that is brain size and volume in specific regions. So there are a couple of regions that are affected or that are involved in decision making, memory, attaching and connecting experience to emotions and movement and mood and behavior. Those are the frontal limbic system, the subcortical region of the brain, the hippocampus, the amygdala, and then there's also the brain matter that is responsible for self-perception and emotions in specific areas. And so when we look at those areas of the brain, it has been proven that those with depression have up to a 20% reduction in volume in those areas than in individuals that do not suffer with depression or have not been diagnosed with it. In women, the average is about 9 to 13% of a reduction in those areas, which makes sense because self-perception and emotions are two of the biggest issues that you see with depression. There's a low self-worth and a sense of hopelessness and helplessness, a lack of being able to make a decision, the inability to focus and sleep well and eat well and just get up and want to do the things that would normally bring us pleasure. And so those areas of the brain have been shown to be diminished in size and volume, which is huge. The second part of that is cortisol. Now, it has also been proven that depressed individuals produce a higher or an excessive amount of cortisol, which is a hormone that's released under stress. And cortisol is responsible for the deterioration of these areas of the brain. So what has not been proven yet is, has long-term stress, which has produced these excess levels of cortisol, diminished these areas of the brain, which has then made like a reciprocal effect and produced more cortisol? Or is the depression with the size of the brain what is causing and triggering an excessive release of cortisol, and it's just like a cyclic effect? That is not sure. That's what we don't know, and that's what researchers are continuing to investigate and try to come up with answers for. Bottom line is this: regardless of what you do or don't think about depression, whether you experience it or don't experience it, know somebody that does, or have a hard time believing that you can't just snap out of it, let me tell you, it's very real. And that is a very real feeling. And the bottom line is this: a friend and I were discussing last night, and I'd give a shout out, but I'm not sure if he wants me to. But he had a very interesting point. He said the bottom line is that regardless of what you experience that would normally bring you pleasure or all these things that you would normally enjoy, you are incapable of experiencing that pleasure like someone that has the appropriate levels of serotonin and dopamine and the appropriate volume in brain. You're incapable of making those decisions like someone else would. You're incapable of having a better self-perception and a better emotion regulation. And that's the gist of it. He hit it right on the head. So it's not that we don't want that. It's not that we don't involve ourselves or can't involve ourselves in doing things. Matter of fact, some of us that suffer with depression, a good majority, will go above and beyond to try to feel something, to try to feel good about. And it just doesn't always happen. It's not for lack of trying. It's for the lack of ability to be able to do it. So, I hope this has shed some light on the subject. I'm not going to get into all the treatments right now. I'm not going to get into all the signs and symptoms. I really want to address that in the next video. But what I wanted to accomplish in this one is just to help you understand that depression is real, that there is a real loss of brain chemicals that help us to regulate our mood and to feel better, to feel happier, to even just feel content, maybe not even happy. There's also a reduction in brain size and volume in specific areas of the brain that contribute to those symptoms that are manifest with depression, which we'll talk about at a different time. I hope this has helped. Please comment if you have anything you want to know or wasn't clear, and I will definitely respond and try to touch base on all those things. But again, my main point here is I want to help bring light to this and give a voice to depression and those suffering with it. I want to break that stigma that says you shouldn't suffer with depression. You can just pull yourself out of it, snap yourself out of it. I hope this has helped, and I look forward to seeing you guys next time.